Welcome back. We have Dr. Justin Cutler with us. He's with Arkansas Orthopedics and Sports Medicine, and you are relatively new in the area, and we want to let you have this opportunity to tell people about you, what you have, I want to say the services you offer there at the clinic, but so I'm just going to let you turn it over to you and tell us a little bit about what you can do for people.
All right. Well, I'll try not to go too far back.
Okay.
I did grow up in Idaho. Went to undergrad out there, but Idaho doesn't have a medical school, so that's what introduced me to the Midwest.
Okay.
Then I had a trip down here to the Ozarks and fell in love. So that's how we ended up down here. Was finding a good place for our family. Married and I have 5 kids, so my wife's an angel. To take care of all those guys.
And they're young. I mean, they're not like old. They're like
no,
out.
it's exactly 13, 11, 6, 2, and 1.
Oh,
So they're a handful, but they're good kids, really good kids, and they love being here, love the area.
So they've adapted well to being in Arkansas,
They did,
which is good.
Really did. And so we've been in the Midwest for over 10 years now, and I've really enjoyed it and love being down here around the recreation. And it's a beautiful place.
A lot of hills down here.
It is not the mountains like I grew up in.
Were there mountains in
hills.
Idaho?
Yeah, we're right in the middle of the Rocky Mountains.
Oh, okay. Yeah. That's where all the potatoes. It's Idaho potatoes.
That's true, and I actually grew up in the middle of that area, in the kind of the farm country and dairyland. Like that. So I'm a farm boy. My dad was a carpenter, so I grew up building homes, and we had a small cattle ranch, and so that's what I grew up doing. But that's I kind of figure what I do now is, I do construction still. It's just on people now rather than on
True that.
on the house.
Well, explain that. I mean, what is orthopedic medicine? What does it focus on?
So our portion of orthopedic medicine is the bone, joints, tendon, muscle units of people. So the structural units holding our body together. We do a lot of knee arthroscopies or knee scope, where we do minimally invasive surgeries there, shoulder surgeries, where through a couple of small poke holes are able to do surgeries what 10 years ago were done through large 6-inch incisions, like I actually have on my own shoulder from many years ago. But technology, techniques, learning over time has really advanced our stage to even the total joint prosthesis we put in. That will do total knee replacements, total hips, total shoulders. And so we can really change the life of people from their pain relief from degenerative processes, post-traumatic arthritis, things where they've been injured, rotator cuff tears, meniscal tears, or cartilage tears in their joints.
Do you do any of the rehabilitation, or do you turn that over to someone else, or you just do the surgical end of it?
I do the surgical end and then direct kind of the rehab process, and so work with a lot of the local physical therapy locations and units to kind of help direct from what I've seen surgically, examine-wise, what the patients have going on, to help them work through a rehab process at that. So I don't do it directly with them, but help lead their care.
But you're directly associated with the North Arkansas Regional Medical Center.
Yes, that's where we do all my surgeries is at the hospital there. They've been great to us. They've treated our patients really well. And so I think that's a really good relationship that people really have a diamond out here. And I don't know if everybody realizes it, but the North Arkansas Regional Medical Center is a 5-star accredited center, which is the only hospital in the entire state of Arkansas for hip fracture and hip replacements. And so they've done an amazing job working with us to be able to have that kind of quality of care for patients. And so I hope people understand that and can know that they're getting top quality care right here locally.
I was going to say, you mentioned beforehand that you have a satellite clinic also in Marshall.
Correct.
And hopefully there will be one in
Yellowville.
There will be eventually.
Right.
So that's also an option for people.
Right.
Maybe in those areas to
Exactly. So to be able to see for diagnoses, sometimes we even if we can start treating them non-operatively, if I can direct a rehab program that so they might not even need surgery, just to be able to focus on different muscle groups, things to help strengthen them and give them relief, and they may feel a lot better that way. Other times, even simple injections. You know, I call them simple because I do them all the time, but I know people don't like needles, but but that's a lot less invasive than surgery. So
Right.
there are times where we can help somebody out with their pain relief by getting them an injection, getting them the physical therapy to help rehab their process and do great there. So that'll be a great location to be able to go to or closer to where people are located and living,
Right.
to be able to provide that. And then if it is a surgical need, bringing them here, perform the surgeries and then see them post-operatively in closer to their home areas.
So there's a process you go through, not just let's just cut on you. Let's go
Exactly.
through the process of diagnosing first.
Exactly. If I had
Yeah.
my way, I would live every day in the operating room because
Yeah.
I
You
love
love
to
that,
do
yeah.
that. I really do. I love to operate. That's what got me to do what I do. But I don't want to just make people different. I want to
Yeah.
make them better.
Yeah.
And
So what's the process if someone watching the show and they say I've got a pain or whatever? Do they see their general practitioner first, or can they call you for consultation, or how's that work?
They sure can. There's only a very few insurances that require a referral from their primary care physician. Some of those will need to go to their primary care physician first, be examined to find out if this is a need that I can provide for them. Other people they can come call directly to me, call our office, schedule an appointment, come in to evaluate, go, what kind of problem are they having? Where is their pain? Why are they having a pain? What are they doing when they get their pain? That history of what's been going on, was there an injury that occurred, is all very helpful to find out, okay, what is their underlying diagnosis? What is the problem causing that issue? And what can we do to make it better? I admit to people all the time, I'm not God at this,
Right.
and I don't heal them. I don't make them better. I help get them in a position where their bodies kind of take care of themselves and help heal the process. And sometimes that requires surgery, is of going in and actually physically reconstructing or removing or adding portions inside to be able to give them that chance to heal. And so we're happy to do that.
Yeah, I guess if they could call a hospital too, they've got reference numbers there for you there if they
do.
need to.
Yeah, the hospital definitely has our office number and things, and the operator I think is who they'd probably get a hold of.
Do you know your office number?
I do know it. It's I've had to write it down so many times lately. Sometimes I have to pull up my phone. Hold on a second, but
Exactly.
it's 870-741-8289, and that's our office. There's somebody there always from 8 in the morning until 5 o'clock at night, Monday through Friday. You can call any time during that time, and somebody will be able to set them up from an appointment, and kind of depending on their location of where they are in the area. If it's better for them to come here to our office in Harrison, or see them in Marshall, or hopefully eventually, maybe even in Yellville.
Working on that, okay.
Cool.
Well, Dr. Justin, thanks so much for being here.
It's a pleasure. Thank you, guys.
Welcome to the area. You've been here for 7 months, but I'm sure that people get a hold of you from the information. And you can get more information at the end of the show, or just call the hospital or him directly at his office number. Thanks so much.
Thank you
Thank
very
you guys.
much.
Really appreciate it.
We'll take a break, and when we come back, we'll be talking with Leon Prinkett, and we'll be talking with him about Heart Fitness Center. Stay with us. Prinkett.